Hello, my name is Sharmishta and I welcome you all to YouTube channel of Sugarfit. I want to ask you a question. Can changes in dietary habit help in improving your metabolic health? Of course it will. Various studies conclude that fasting does help in enhancing overall well-being, which also includes your metabolic health. Fasting helps in maintaining your glycemic levels, improving your insulin sensitivity, reducing your insulin resistance, and thus enabling the weight loss. But before we get into the workings of overall metabolic functions of your body, let's start with some basics. What is fasting? Fasting can be defined as a duration of voluntary absence or restraint from food and drink. Fasting can be done by either reducing the amount of food you eat or by restricting the intake of calories in that particular duration. Fasting has been practiced throughout the human evolution, right from the time hunters of gatherers. Just like humans have evolved to be in sync with the circadian rhythm, like the day and night cycle, our metabolism also has adopted to daytime food and nighttime sleep. There are a number of reasons for an individual to adopt a fasting regime: to lose weight, for religious, spiritual reasons, or just as a lifestyle strategy to improve health. Although every person performs fasting in his or her own way, finding an eating pattern that suits you and your reasons for doing it may sometimes not be what's best for you. So, to decide on which approach might be the right fit for you, let's learn about the various types of fasting and their benefits. What are the types of fasting? So, basically, there are many types of dietary approaches that involve interspacing planned period of fasting with regular eating. On my list, I have some most popular and effective types of fasting. Let's go on one by one. The first one is intermittent fasting or 16 is to 8 diet. The method basically that is followed is fast for 14 hours to 16 hours a day and limit your eating window to 8 to 10 hours. Based on your preference, you can consume 2 or 3 meals within that eating window. For example, a 16-hour fasting window would be like if you eat your dinner at 8 p.m. on Monday and fast until your next meal at 12 p.m. noon on Tuesday. The second one on my list is periodic fasting or 5:2 diet. Restricting your calorie intake to 500 to 600 kilocalories for 2 days in a week and eating normally the other 5 days. That's the method. I'll give you an example. Eat a small meal, about 600 kilocalories on Tuesday and Friday. Continue eating regular meals on the other 5 days. The third one is eat, stop, eat, or 24 hours fasting. A 24 hours fasting once or twice a week is the method that you follow. For example, a 24-hour fasting window would be like if you eat your dinner last meal, which is at 8 p.m. on Monday, and fast until your next meal at 8 p.m. on Tuesday. The fourth one on the list is alternate day fasting. Fast every other day by restricting quantity of either consumption of calories to less than about 600 kilocalories. For example, eat your regular meals on Monday and restricted calorie intake to 500 kilocalories on Tuesday, and go back to eating a regular meal on Wednesday, and so on and so forth. The last one is extended fasting. It is a form of intermittent fasting involved extended pause on eating. So, for example, eat your lunch at 2 p.m., which would be your last meal on Monday, and then stop eating or then start your fast from that Monday. There are multiple benefits of fasting. Let's talk about weight loss first. Fasting may lead to weight loss due to two primary reasons. First, it restricts the intake of calories, thus allowing the body to use its fat reserve. Second, it also maintains a low level of insulin, thereby keeping the body in fat burning mode. It helps in shredding both muscle and fat mass. Practicing it for a significant period may result in reducing the resting metabolic rate and assist in weight loss. When combined with resistance training, it decreases the fat mass and improves your health-related biomarkers. It also helps in reducing your appetite by maintaining the hunger hormone called as ghrelin that tells you when to eat. The next benefit is metabolic flexibility. The body stores energy in the form of glycogen and fat. In high blood sugar levels, your cells use a part of this energy and stores the remaining portion in the liver or muscles in the form of fat or glycogen. During fasting, there is a depletion in glycogen reserves and the body switches to fat for energy. These fats are converted into fatty acids and then to ketones to produce energy. Using ketone bodies instead of blood glucose for energy may improve your organ functions. It will also improve your neural health and overall muscle functioning. Switching between the fed and the fasting state makes your body more metabolically flexible. During feeding state, the primary energy source would be glucose, while during the fasting stage, your body is going to use fat as fuel. More the metabolic flexibility, more the fat burning after a heavy fat meal. The third one, and a very important one, is insulin sensitivity. A comprehensive research study assessing a long-term effect of reducing intake on energy states that calorie restriction reduces various cardiometabolic risks and significantly improves your insulin sensitivity index. Time-restricted eating helps in maintaining the circadian rhythm. Just changing the timings of your meals by eating earlier in the day and extending the overnight fast significantly benefits your metabolism. While a disruption in the circadian rhythm may result in abnormal sugar metabolism and insulin resistance. Now, when you start fasting, managing your carbohydrate intake is very, very important. You should monitor your glucose intake to get the best out of your fasting. Aim for a low glycemic diet to improve metabolic flexibility. So let's talk about few steps that you need to take when you start fasting. First is breaking your fast. Your hunger hormone is going to make you feel craving for glucose or sugar, especially in the initial days of starting the diet. On eating, this can suddenly raise your sugar levels and cause even more food craving and irritability. So it is essential to choose a meal that does not cause the surge in your blood glucose. Limit the hours of day when you eat, and for the best effect, make it earlier in the day, between say 7 a.m. to 3 p.m. or even 10 a.m. to 6 p.m. But definitely not in the evening before bed, and avoid snacking or eating at night times. Second most important is monitoring your diet. Many people eat a heavy carbohydrate diet just before fasting window. Avoid doing this, as this takes more time for the body to switch to fat-based fuel. Avoid sugars and refined grains, and eat fruits, vegetables, beans, lentils, whole grains, lean proteins, and healthy fats instead. Let your body burn fat between meals. Don't snack and be active throughout the day. Bottom line, eating healthy is simple, but it can be incredibly hard to maintain. At the end of the day, there is no one-size-fits-all solution when it comes to nutrition. If you feel good when fasting and find it to be a sustainable way of eating, it can be a very powerful tool to lose weight and improve your health. Along with fasting, exercising, taking care of your sleep are also important factors to focus on. So the best diet for you is the one you can stick to on a longer run. Thank you so much. I hope all this information helps you to reach your healthier self.